And welcome everyone, and thank you for joining us this afternoon. Today's NCCOR Connect and Explore webinar is entitled Preventing Childhood Obesity in Latin America, an agenda for regional research and strategic partnerships. It'll be presented in four sections by four speakers. The first is Latin American nutrition transition, followed by childhood obesity prevention in Latin America from research to practice, and then a research agenda to guide progress on childhood obesity prevention in Latin America, and finally, capacity for research on childhood obesity in Latin America. Following all four presentations, you will have a chance to ask speakers in our one-on-one question and answer session, and then there will be a quick announcement or two about other NCCOR activities. Now, just a couple of technical notes before we get started. If you have a question for our speakers during the presentation, please write it in the chat box on the right side of your screen. And if you needed technical assistance during today's webinar, you can also use that chat box to send us a question, and we'll help you out. If you're having trouble logging into the webinar, but you can hear us on the phone, then you can email us at ncor@fhi360.org. That's ncor@fhi360.org. And we'll work with you to resolve the problem and get you on the webinar. Finally, one more important technical note. If you've decided to listen to our webinar today using your computer speakers, please turn down or mute your computer microphone. This will greatly reduce the potential for background noise. So thanks, everyone. We'll also be live tweeting during today's webinar. If you are on Twitter or other social media, we encourage you to join the conversation using the hashtag ConnectExplore and following the Twitter handle at NCCOR and on Facebook at ncor.org. On our speakers today are Juan Rivera de Marco, Camila Corvalán, Rafael Pérez-Escamilla, and Michael Pratt. First, Juan Rivera de Marco is the General Director of the National Institute of Public Health in Mexico and Professor of Nutrition in the School of Public Health. He'll provide an overview of the supplement published in Obesity Review and its development, and present a research agenda for the prevention of childhood obesity in Latin America. Then Camila Corvalán, will speak. She's an assistant professor at the Institute of Nutrition and Food Technology at the University of Chile. She will discuss the current nutritional status of Latin American children and the drivers of the obesity epidemic there. Rafael Pérez-Escamilla is a professor of epidemiology and public health and director of the Office of Public Health Practice and director of global health at Yale University School of Public Health. He'll follow Camila by sharing and to share lessons learned from Latin American countries to successfully implement obesity prevention policies. And finally, Michael Pratt is a professor in the Division of Global Health at the University of California, San Diego. He will highlight opportunities for childhood obesity prevention research and research capacity in Latin America. We're very grateful to all of our speakers and look forward to hearing them today. And now, I'll turn it over to Dr. Rivera for an introduction to the Obesity Review Supplement. And just a note, while NCCOR did not play a role in planning the workshop or publishing the review that you'll be hearing about today, we're so pleased to be able to share the research findings and recommendations with you. Dr. Rivera.
Good afternoon. I am very pleased to be here today.
Dr. Rivera, can you hear us? Michael, would you like to just provide the opening slide while we're waiting for Juan?
Sure, I'm happy to step in.
Thank you.
And this is the slide that we have up now, Preventing Childhood Obesity in Latin America, Obesity Review Supplement 2017. Am I starting in the right place?
That's right.
Yes, okay. Well, thanks to everybody for being part of this. As you can see, our objectives for this workshop were to stimulate dialogue among a variety of stakeholders about both the state of the science and future directions for obesity research in the region. And in order to do that, we really needed to discuss the socioeconomic disparities, food policy, urbanization, nutrition, and physical activity across the region, and how they developed. And obviously, Dr. Corvalán is going to be discussing those in more detail. And address programs and policies related to curbing the obesity epidemic. And Latin America is an especially interesting place for that because of the abundance of creative policies. And our participants in the workshop were a mix of stakeholders, researchers, of course, as you would expect at NIH, but also policymakers and representatives of non-governmental organizations from both the United States and Latin America, and our hosts at the Fogarty Center at NIH and a number of other NIH offices and institutes with a stake in obesity prevention. So our goal in the workshop was to describe some of the disparities within households, countries in the region, look at both distal and proximal causes of childhood obesity, address some of the barriers to obesity prevention and the challenges. And as such, we carried out a landscape analysis. We looked at what the research priorities were, looked at some examples of application of research to public practice and policy, and finally addressed issues around how to develop the research capacity and how to develop the capacity to translate that research into practice. I think that an analysis of the existing literature really highlights our need to build strong research capacities for individuals, institutions, and build the sort of partnerships and networks and collaborations that allows application of that capacity. You can see on this slide the speakers that we have coming up, and first of those, Dr. Camila Corvalán from the University of Chile, who is going to look at status of nutrition and physical activity during childhood across Latin America. And we will also have Dr. Rafael Pérez-Escamilla from the Yale School of Public Health, who is especially looking at research to practice related to prevention of childhood obesity and food policies in Latin America. Dr. Rivera, assuming we will get on back on, will be presenting the research agenda which was developed out of the workshop in this multi-stakeholder process. And then finally, I'll close with a discussion around both current capacity for research in the region, some of the challenges associated with trying to further develop that research capacity. And to close the introduction, I want to show a picture of the group that was assembled thanks to leadership of Nalini Anand and others at the Fogarty Institute, and it really was an excellent few days there working on these issues, and hopefully you will find the product of the workshop, both the papers that have been published and this webinar, of interest. And I think that sets up Dr. Corvalán to give the first lecture in today's webinar.
Thank you, Michael, and thank you everybody for being here today. We will start by reviewing what is the current nutrition situation of children in the Latin American region. As you see in this first graph, stunting is currently the primary nutritional problem in the region. However, it's remarkable that also we have high rates of overweight and obesity in children below 5 years of age. In fact, the Latin American region is the region that has the highest prevalence of childhood obesity worldwide. The coexistence of stunting and overweight, it's not only taking place at the national level in our region, but it's also taking place in the same household. So we would find in the same household a child that is stunted and a mother that has excess weight. This condition can be very prevalent in countries such as Guatemala, but in other countries it's almost non-existent, like in Brazil or Colombia. It is also very relevant to take into account how obesity may vary depending on the characteristics of the population. Here we see that nowadays obesity tends to be more frequent in high-income children. However, new data indicates that obesity is primarily increasing in low-income population. So we can assume that in the future, this situation will reverse and we will have rates concentrated in a more poor population. So what are the drivers of this epidemic? First of all, diet. What we have observed in the last 10, 15 years is that the purchases of products such as beverage, sweet snacks, and savory snacks have, with some exception, increased in most countries of the region. As a result, our diet nowadays is compounded of more energy, more saturated fat, more sugar, more salt. In terms of the drivers of these changes in diet, we need to look into very distal drivers, such as, for example, the changes that we have observed on our market, in our trade agreements. We know very little about that, but we are certain that the changes in our trade agreement has impacted the type of food that we have access in our daily life. We also have been observing in the last decades an increase in supermarkets, and nowadays in the majority of the region, more of the 50% of the food sales are occurring in supermarkets. This is relevant because we have evidence that in supermarkets, we tend to buy more processed and ultra-processed food than more natural or less minimally processed foods that are typically obtained from open markets. At the same time, we have also been observing in different countries in Latin America an increase on fast food restaurants. And again, this is relevant because the consumption of food from fast food restaurants tends to be high energy dense and low in micronutrients and other type of benefit of nutrients that are beneficial for health. Finally, in the case of children, the school is definitely one of the most important environments for defining the type of diet that children have. We know that it's important what takes place outside of the school. In the case of Latin America, what is taking place with street vendors, but also what happens inside of the school, what happens in the canteen and with the food assistance programs. Here we are showing evidence from Brazil that indicates that if in a canteen we sell soft drinks, salty snacks, and sweets, it's more likely that the children will be consuming those products. The other important determinant of energy equilibrium is physical activity. Unfortunately, we do not have comparable data on the region on what are the levels of physical activity, but we do know that from the Lancet series that Latin America is one of the most inactive regions worldwide. Why is this happening? We have moved into urban cities. Latin America is the most urbanized region in the world. More than 80% of the people live in cities. And we also know that most of our physical activity comes from transportation. We do not do a lot of sports during our leisure time. And the evidence also show that the way that we move to our works and to the schools have been changing in the past decades, moving from cycling and walking to using cars and motorcycles. We also know that the neighborhood impacts our physical activity. This is evidence from Mexico showing that people like to have neighborhoods that are with the necessary infrastructure, that are safe, and that are close to parks in order to be able to exercise. Again, the last important environment for children is the school. In the case of children, we have few evidence from the region regarding how this will impact the physical activity of children, but we do know that most of the vigorous and moderate physical activity takes place in the school, so this is a venue in which we should be working for increasing physical activity. So in conclusion, we now see in Latin America a situation in which a high prevalence of stunting coexists with high prevalence of obesity in children. There are important disparities within and between countries, including ethnic differences, and this is relevant to characterize in order to provide the adequate actions in the adequate population. This new scenario is the result of rapid changes in food and physical environments, particularly the increased urbanization and supermarket penetration of our region. And this is also important to note because this will continue to happen in the future. In summary, to stop increasing the increasing trends of obesity, countries in the region, we need to acknowledge this new reality, and we need to adapt our nutrition status monitoring system, our healthcare system, and our social support system. I will end by saying that a number of actions are taking place in our region, so I think we are in the right way to achieve it. Thanks.
Well, thank you so much, Dr. Corvalán. And again, if you have a question that you would like to ask her, please use the chat box on the right of your screen, and we'll address it during the one-on-one segment following the presentations. Now I'll turn it over to Dr. Pérez-Escamilla.
Thank you very much, Elaine. And it is now my turn to present to you the second paper from the supplement that leads with understanding the lessons learned from the translation, I would say the successful translation of obesity prevention research into policies and practice. And you can see that this was a teamwork, and all my co-authors are clearly acknowledged in this slide. So because we have limited time, I will focus on excise taxes on sugar sweetened beverages in Mexico, front of package label legislation in Chile, trans fatty acid removal from processed foods in Argentina, and then briefly on ciclovías recreativas or open streets in Latin America. So the approach, the methodological approach that we used was first to develop for each of these policies their corresponding case studies with strong input with at least an expert that was very, very heavily involved or knew quite a bit about the history and what took for that policy to be developed. The policies were selected based on their level of implementation, visibility, and potential impact to reduce childhood obesity. We then applied sound qualitative research methodology to code the case studies to identify the components that explain the successful implementation and sustainability of these obesity prevention policies in Latin America from the lens of the complex adaptive health systems framework. So what I will now do is to briefly summarize for each of the case studies why the policy originated, which were the key milestones that actually happened before the implementation of the policy, and lastly, the enabling factors. So Mexico built very heavily on the evidence behind the taxing of tobacco products to strongly justify the likelihood that they would be likely to work also with regards to sugar-sweetened beverages. Mexico also chose the sugar-sweetened beverage tax route because the congressional processes for determining fiscal packages have a deadline every year that has to be met. Thirdly, because the public pays a lot of attention to anything that has to do with taxes as well as policymakers. And fourth, because there was an expectation that if this policy worked, they would be able to show results with regards to sales and consumption reductions very rapidly. The key milestones surrounding the tax policy in Mexico was that it was finally approved at the Mexican Senate in 2013, very rapidly launched in January of 2014, and the findings showed first and foremost that there was a huge amount of revenue collected by the government as a result of the policy, $18 billion in 2014. As unexpected, the price of the soda increased and the level of consumption decreased. The factors that enabled the implementation of this policy in Mexico were very strong evidence-based advocacy, engagement from the Ministry of Finances, the political support from several political champions, and the very high-level policy research that included work done by the National Institute of Public Health in Cuernavaca, which was the basis, as well as the Academy of Medicine, for developing data-driven policy statements that ended up having a very strong impact on the decision makers. With regards to the food labeling and advertising law in Chile, this happens because Chile felt very strongly that there was evidence to back up the strong likelihood that if user-friendly food labels were adopted in the country, that would lead to improved dietary quality, and also because there was plenty of evidence that unhealthy marketing from the food industry was indeed having an impact on the dietary choices and behaviors of children. The key milestones for Chile: the first bill was introduced in 2007. After 5 years of trials and tribulations, Congress approved the law, and after 3 years of trials and tribulations, the policy was implemented, and implementation started in 2016. The factors that enabled the implementation of this policy in Chile were very similar to the case study of Mexico: a very strong presence of a very charismatic senator who was a major political champion for this effort to happen, academic champions, civil society champions, and also the very high-level political support all the way up to the level of the president of the country. And the ability for Chile to undergo a dialogue that had to lead to important compromises with the food industry for this law to be passed and the policy to be implemented. With regards to the elimination of trans fatty acids from processed foods in Argentina, there was plenty of evidence to support the consideration of this policy with regards to the negative impact of trans fatty acids on coronary heart disease. It was very clear that the trans fatty acids, industrial trans fatty acids, were concentrated in processed foods, and also in Argentina, oils and fats were being produced by just a few companies, making it highly feasible to actually propose a policy that was realistic, and also realistic from the point of view that other countries had already indicated that it was technically feasible. The key milestones range from the voluntary initial reduction in 2006 all the way to the enforcement of the new regulation in 2014 and the beginning of the monitoring in 2015. And the enabling factors were similar based on the champions, the role of the dialogue between government and food industry, and the very strong role of research and academia providing the evidence to support the policy. Ciclovías recreativas, there was also quite a bit of evidence supporting the fact, and there is, that sedentarism is very, very bad for health, that given the high level of urbanization of Latin America, it was important to give a respite to the population and allow them to have access to streets that would be close to the traffic of motorized vehicles for families to enjoy some leisure time and opportunities for physical activity. The ciclovías have been shown to be technically feasible, and we believe that that has led to their major expansion throughout Latin America. The first ciclovía recreativa was launched in 1970 in Colombia, and by 2015 there were more than 100 kilometers of car-free streets. And with regards to the enabling factors, a very strong support from the public, and the reaction of the population towards a positive reaction, a measure that will give them a respite from the car-centered urban development. Cost-effectiveness work, and again, evidence documenting the fact that this policy was feasible and likely to work. So if we list the factors that collectively led to the successful of these policies, are the champions, the political will and support, the legislative process, intersectoral dialogue and coordination, and research and evaluation. But perhaps the most important contribution from this paper was to try to identify the factors that actually led to the different pathways that the different countries took for the implementation of these policies using a complex adaptive systems framework, trying to understand not only how it became successful within a country, but in the case of ciclovías, how rapidly they ended up spreading from one country to the other after 40 years of experimenting with them, starting in the year 2000. So I am running out of time, so I will briefly mention that we identified positive and negative feedback loops, and the positive feedback loops that allowed for these policies to be successful included the participation of civil society through media campaigns, the evidence-based policies from the National Institute of Public Health in the case of Mexico, the compromise of Chile with the food industry, and in Argentina also the multi-sectoral dialogue. These were very important drivers that catalyzed the ability for public opinion and policymakers to support these policies. All of these policies ended up emerging as a result of the combination at the right moment, at the right time, of all the factors that have been previously mentioned. And also, we identified very clearly with the ciclovías the fact that sometimes it takes a long time from the start of an idea before it actually spreads heavily as a result of showing that it works and having the experience to transfer and transmit from one country to the next. And finally, I want to mention that as part of the complex adaptive systems framework, we were able to document that even though we had different countries like Chile and Ecuador implementing the same policy in principle, it ended up with very, very different results. As you can see, the octagons in the case of Chile versus the traffic light approach used in Ecuador. So in conclusion, the implementation of evidence-informed anti-obesity policies continues to gain a lot of momentum in Latin America. It is very important to continue doing this complex adaptive systems work because translating science into policy is a highly complex, multi-directional, nonlinear process. There is a need for multi-sectoral coordination and to continue generating evidence-based to support these policies. And last but not least, I do want to say that even though this is about Latin America, all of this experience from Latin America has a major impact globally. because really Latin America is light years ahead, for example, from the U.S. when it comes to obesity prevention, evidence-based policies such as the ones discussed. And this is a clear example of how Canada now, inspired by Chile, is proceeding in the same direction with regards to their new food labeling approaches. Thank you very much.
Thank you. That was just terrific. And just a quick reminder, if you have a question, please add it to the chat box where there's an ongoing conversation, and we will pose those questions to our speakers at the close of the presentations. So I'm going to turn it over to you, Dr. Rivera, and I think you have been able to join us again.
Yes, thank you very much. I am very pleased to be able to present the paper on research agenda to guide progress on childhood obesity prevention in Latin America. And as you heard in the previous papers, childhood obesity rates in Latin America are among the highest in the world. We examine and evaluate efforts in the region to reduce and prevent obesity. We also identify and discuss research challenges and opportunities in Latin America, and we propose a research agenda for the prevention of childhood obesity and non-communicable diseases that is relevant for the region. We identified the key research gaps, which include first, the biological challenges to healthy growth across the life cycle. Also, the dynamics of diet and physical activity. These behaviors, diet and physical activity, are complex behaviors that are the result of the environment and also individual choices. And it's very important to understand the dynamics. Then also community interventions promoting healthy child growth. What are the elements of these interventions, the ones that are successful, the ones that are not? And then we also identified as a gap rigorous evaluation of national food and activity programs and regulatory actions. And we concluded that addressing these gaps is critical to advance evidence-based effective policy in childhood obesity prevention tailored to the Latin American context. We really identified the need to understand direct and underlying drivers of dietary and physical activity patterns, including the food environment and the food system and the changes in these two environments and systems. The first thing that we note is the presence of supermarkets, convenience stores, fast food restaurants that have dominated the food scene since the 1990s, and we really need to understand more the effects of this new environment in the dietary intake and obesity. The abundance of energy-dense, processed, high sugar, high fat, and high sodium foods and sugar-sweetened beverages that have changed radically the food environment in the region and how these operate to have an effect on obesity. Little research has tackled the impact of these changes on food purchasing and consumption behavior, and there is a clear need to better understand the global food system transformation and its determinants. We also identified the need for the evaluation of government efforts to create healthier diets. As mentioned before, Latin America is a region where policy actions have been implemented aimed at reducing obesity, preventing obesity, and there are some policy actions that have been implemented, like front-of-pack labeling, restricting unhealthy foods in schools, dietary guidelines, taxation, restricting marketing to children, and we need to rigorously evaluate all these policy actions so that in the future the literature on evidence-based intervention will be more rich. Little is known about the effect of media, education, and marketing on food purchasing and consumption. And then we need process and impact evaluations that are very important for appraising complex interventions and implementation approaches that ultimately advance effective solutions. We also identified as a very important issue to understand the environmental and psychosocial correlates of physical activity, including societal changes in Latin America that are likely to reduce physical activity. Unfortunately, very little documentation is available regarding these societal changes and the effect on physical activity outside of Brazil. We need to understand the impact of social environments on physical activity, for example, crime and traffic, psychosocial variables like social support and perceived barriers in the environment, and biological variables, for example, obesity and genetics on physical activity. And we need to understand their independent effect and also their concert effect on obesity and its comorbidities. Little is known about the correlates through cross-sectional studies and the determinants through longitudinal studies of physical activity in Latin America. There is a need to understand more the surveillance and measurement of physical activity and diet. There are research gaps in measuring these two phenomena. We need detailed measurements of food, energy, nutrient intake, physical activity, energy expenditure to inform policy, and we need to improve the measurement methodology. We need national representative anthropometric, dietary, and physical activity surveys, and that the surveys contain the three of them at the same time. We need food composition tables. Particularly, we need to incorporate in the databases the new foods that are developing every day, that are new in the market, particularly on bar-coded food and beverages. We also need, there are some surveillance and measurement technique gaps related to physical activity that we need to address through research. For example, self-reports of physical activity are not as reliable as objective measures. Self-reports of individual behavior do not capture environmental, social, and individual correlates of physical activity, and there is limited data on the quality and quantity of physical education and opportunities at schools. We need to understand evidence-based interventions, conduct research in a variety of areas to inform evidence-based policy and programming, combine behavior change strategies with environmental modifications and policy change, develop multi-sectoral, multi-level policy action, and when designing programs, prioritize approaches that can be scaled up for population impact. Finally, we need to evaluate the effect of behavioral change strategies. And finally, in Latin America, we have been leaders in initiating regulatory actions and multi-sectorial policies, but many of them lack evidence of efficacy. So we really need policy evaluation that can help identify best practices to understand the accomplishments in pricing, for example, taxes, in promotion, for example, marketing and labeling, and on the built environment. And the evaluations should use multiple disciplines and methods to assess implementation and impacts of policies. Take advantage of natural experiments and use mixed method research, and measure the on-the-ground impact of policies and programs, and identify any needed changes in additions. This is a brief summary of the research priorities for the prevention of childhood obesity in Latin America.
but a very rich research and evaluation agenda that you've laid out. Thank you so much. Another quick reminder to enter questions in the chat room, and I will turn it over to Dr. Pratt. See, Michael, did we lose you?
Mr. Pratt's line is currently connected. He may have just come.
Sorry, I had myself muted still.
Okay.
So I'm delighted to be unmuted and to join the conversation. And I will talk about research capacity for childhood obesity prevention in Latin America. And I want to thank my co-authors, who you can see here on the first page of the article from which this presentation is drawn. We initially needed to define what we meant by research capacity, and we drew on the literature and experience of the group to come up with this definition. The ability of individuals, institutions, and networks to pursue locally relevant research, maintain a career pipeline for scientists, and promote a research environment that is conducive to multidisciplinary collaboration, and skill sets and support systems that enable the transfer of evidence into policy and practice. The question is, how does one measure research capacity? And we believe that there are a variety of ways to do that, some of which are rather challenging to collect data on. Academic infrastructure, the presence of national research funding, doctoral and postdoctoral training programs, which produce the sort of skilled researchers required to do complex research on a subject such as obesity, the number of active researchers, and probably the most accessible of these areas, publication and citation metrics, which is the one that we chose to concentrate on. And finally, the ability to communicate results at national and international conferences and in national and international peer-reviewed publications. And you can see from these two slides that we believe that capacity to do research is intrinsically linked with the capacity to apply that research, translate the research to practice. So in order to carry this study out, we reviewed the PubMed and LILAC databases from 2010 to 2015, which allowed us to access English, Spanish, and Portuguese language articles on obesity, nutrition, and physical activity in Latin American countries. As in most of these types of searches, we started with a large number of articles, 1,253, narrowed that to 569, which met our basic inclusion criteria. And after we reviewed and coded these with at least 2 authors doing this for each article, we ended up with a final analytic sample of 484 articles. And the data that I'm going to present in the following slide comes from the summation of these articles. And within these, we identified the author, affiliation, and nationality, affiliation, the university or institute they work from, the research topic, and the study design. You can see here that we identified 5 basic topics: obesity, physical activity, physical inactivity, physical fitness, and nutrition and diet. You can read the definitions in more detail on the slides, as you can for the descriptions of the study design. And we broke the study designs into descriptive studies, qualitative studies, measurement studies, correlates studies, intervention studies, and policy studies. And then a handful defied classification easily. So the next several slides, I'll present the data drawn from these nearly 500 papers over the last 5 years. And here we look at the number of published studies by research topic across Latin America. And I think you can see that the numbers across all the categories were increasing from 2010 up through 2015. 2015 is a partial year. We only collected data up through May. Thus the seeming drop-off there. On the second slide of results, we see the number of published studies by study design. And here you can see that the first two bars for each year representing correlates and descriptive statistics are much higher, representing many more studies than those coming in measurement areas, interventions, or qualitative studies, or policy, where you see almost no studies. If we look at the number of published studies by research topic and study design across the same time period, here you see across the x-axis clusters related to each of the main topics, obesity, nutrition, and the 3 physical activity-related topics. And on the y-axis, you see the number of publications, first from correlates and then descriptive statistics. And again, these account for the vast majority of studies across all the topics, and we see significantly fewer studies for measurement and interventions and not many at all for policy. One interesting finding here is that we see a few more measurement studies in obesity and a few more of the intervention studies related to physical activity and nutrition. So to summarize the last few slides, obesity has been the topic most frequently explored by researchers in Latin America over recent years. Promisingly, we see an increase in the number of publications across all these topics. The vast majority of studies are observational and cross-sectional studies. While I didn't show it on the previous slides, only 56 of the nearly 500 studies were longitudinal. And so these are studies carried out with multiple data collection points over time or following a cohort of people over time. These require more complex study design, are generally more expensive to carry out, and we think that part of the absence of these studies reflects a lack of capacity required or a lack of funding for more complex study designs. It's really quite striking that we have a very low number of intervention studies and a near absence of policy articles published across the region on topics which have great policy relevance. So I think there's a clear need to improve research capacity in these areas. I'll finish up just by showing a few slides of network analysis. And in these slides, the size of the globe represents the number of papers. And you can see that in this one, we look at published studies by lead author, country affiliation, and research topic. Brazil, Mexico, and Chile account for most of the papers, which are spread across a distribution as previously described. If we look at published studies by lead author and study design, we see again most of the studies in Brazil, Mexico, and Chile, and most correlates and descriptive statistics. And then finally, if we look at collaboration across countries, there's a remarkably small amount of it. Very few co-authorships drawn from multiple countries. So in summary, many publications from Brazil, Mexico, and Chile, quite substantially fewer from other countries, suggesting a real need to increase capacity there. And that the extent of the problem and associated factors are really unknown in many of the countries in the region. So we do need to build research capacity to document the current state of childhood obesity in more countries, and even in Brazil, Mexico, and Chile, more capacity to design evidence-based prevention and intervention efforts and do policy studies. There are limitations with this approach. We didn't have data that allowed us to address many factors outside of publications, and those can clearly be an imperfect way of classifying research capacity. And then finally, where do we go next? I think we are moving nicely beyond child survival and communicable disease research in the region, but we need to increase across the full spectrum of obesity prevention, especially related to intervention and policy research. And we think that regional collaborations and networks may be one of the ways to do that. There have been some nice examples supported by the National Heart, Lung, and Blood Institute and the Centers for Disease Control, Unfortunately, neither of these projects is currently funded. So I think there's space for more support for this type of networking and collaboration in the region. Thank you.
Well, thank you so much. I'm stuttering here because we don't have as much time for questions as we usually do. And thank you, Dr. Pratt. I know you were shortening your presentation. We do have a really fabulous conversation going on in the chat box, and I will just tell you first of all that we will be able to provide all of these questions to our speakers and provide you with the answers to the questions on the website along with the presentation, recording, and slides. So we're not forgetting you. We're just a little bit short of time. And I wonder, Dr. Corvalán, if you have a brief comment about what kind of data should be collected to better characterize the nutrition situation of children in Latin America. Priorities there?
So thanks. Basically, I think that it's relevant to collect data on the different levels. We need to collect definitely better data on diet and physical activity, taking into account the different populations, and then we need to collect more systematic data on the drivers, so how the food environment and the physical environment is changing, so we can really try to anticipate how diet and physical activity will change in the next few years in the different populations.
Great. Well, thank you so much. And Michael, you get the final comment. Just quickly, is there evidence about what strategies are important for increasing research capacity and productivity, since that was so evidently needed?
Yeah, yes, I think we can look at the countries in the region that have done well, and they're characterized by strong universities and research institutes and a special emphasis on early career training, oftentimes providing good scholarship support for doctoral students and postdocs, and frequently sending them abroad to train in laboratories and in institutes around the country. That in turn sets up good global collaborations, which tend to mitigate some of the lack of funding and lack of career support in countries which have fewer resources. So I think supporting these international collaborations really is a key to building capacity beyond the three countries that have clearly done quite well in the region.
Great. Well, thank you so much. And just quickly, one upcoming event, March 27th, stay tuned for a major webinar on lessons learned from 10 years of NCCOR. I want to really thank all of our speakers and for all of you who have attended today with great apologies to Dr. Rivera and all of you for the technical difficulties in working across countries. So if you have other questions, here is the email address, ncor@fhi360. And we're going to switch over right here. There is, I thought it was right here, a slide. Before you, when you sign off, there will be a screen that comes up, and we hope that you will answer a few quick questions about your feelings and perspectives on this webinar. It will really help us in planning future webinars. So just a very quick survey, and we'll switch over to that feedback form now, and look forward to seeing the answers to your other questions online. And again, a great big thank you to all of our speakers and everyone who contributed in the chat and listened today.